recording today's webinar. And glad to have you today with us for our last webinar. Housekeeping, as always, feel free to ask any questions in chat. We will try to collect those for the very end. And as always, also, you'll receive slides in our follow-up email. And in addition to asking questions in chat at the very end in our Q&A, please feel free to either comment in chat or to use the raise hand function. So on the next slide, we're the Council of State Government's Justice Center, a national nonprofit, nonpartisan organization. And we serve all three branches of state governments and counties as well to increase public safety and strengthen communities. On the next slide, get into our agenda for today. So you'll hear from first Brenda Graylish, and we'll turn it over to Chief Mac Jenkins. Then we will briefly talk about our report as it's related to rental assistance and supportive services, try to keep our portion minimal today. Then you'll hear from folks at Amity on their lived experience, from DHCS on Cal-AIM, and as well from Daniel Wildcrest and Whitney Lawrence on flexible housing subsidy pools. And we'll wrap it up with Q&A and resources. We might run a bit over today. And if you have to leave, no worries. As always, we will send along the recording when they're up on our website. And for those of you waiting for our fourth session, it will hopefully very soon be up on our website. And now I will turn it over to Brenda on our next slide.
Thank you so much, Thomas, and just want to welcome everybody here today. Appreciate you taking time out of your busy schedules to help us round out this five-part series, as Thomas had mentioned. We at the Council on Criminal Justice and Behavioral Health see housing as foundational for reentry and transitional populations, people who have become involved with the justice system and have suffer from various behavioral health conditions. And so this has been such a wonderful webinar series. So want to definitely send a shout out to the CSG Justice Center team for doing such a fabulous job and pulling all of this information together on this extremely complex topic. I'm kind of new in this space, and so I feel like I've been getting a crash course. Probably many of you feel that way as well, and really trying to become multilingual in the systems that serve the justice-involved population. And so just want to thank all of you, and then also, of course, give a shout out to the California Healthcare Foundation for making all of this possible for us to be able to do. And I think this is great foundational work for a lot of conversations that are going to be ensuing in the next several months and in years to come as we bring all these various investments that our administration has been making in housing to fruition. So with that, I am really excited to introduce our next speaker, our council member here at CCJBH, Chief Jenkins.
Thank you, Brenda, and thank you, Thomas, and the CSG Justice Center for the opportunity to make a couple of comments. And Brenda, you always make such important points, and I want to amplify a couple of them, but by just way of very brief background, as Brenda mentioned, I do serve on the council with Brenda, Council on Criminal Justice and Behavioral Health, and I think I've been serving since 2015. And my career in the criminal justice system spans 40 years, actually, all of it on the probation side, or what I also talk about is the community corrections side. And the reason that I mention the length of time that I've been involved is that I've learned a lot over the course of that career. And I will also suggest to you that the criminal justice system itself has learned a lot. Among the things we've learned is that the mission and purpose of CCJBH, as well as the topic of this webinar, is, as Brenda described, foundational to well-serving individuals who have entered the criminal justice system with behavioral health needs. And that's a really, really important point, because when I started in criminal justice 40 years ago, I can tell you that there was not a lot of discussion, there was not a lot of training, there was not a lot of emphasis on the fact that individuals who came into the criminal justice system and who were placed on probation actually had behavioral health needs. And now in this day and age, in 2022, I think that we are doing a much better job of that recognition. And in fact, I won't go too far into this because Brenda's heard me say it 1,000 times. I do not use the term criminal justice reform. And I don't use that term because it masks what is actually happening with criminal justice. And what is actually happening is the criminal justice system, where it's smart, is learning and applying the lessons of research, studying what is impactful on a justice-involved population, particularly those that are returning to communities from incarceration. And among the things that we've learned and that we're doing a better job of applying now is kind of captured in the risk need responsivity theory, which I hope people on this webinar are familiar with. If you're not, you should be. Particularly if we're going to talk about the intersection between criminal justice and behavioral health. But what is important about that theory is risks talks about the level, the likelihood that someone will recidivate. The need talks about areas that should be addressed, but the responsivity areas talk about barriers that are in the way, that can be in the way to better outcomes for the justice involved. And among the most important of responsivity factors is housing. Individuals that are justice involved and have been repeatedly justice involved, maybe have many arrests, et cetera, and things along those lines, frequently have in their histories or their presenting situation, a situation of not having a place to live or having a history of unstable housing. And so we know now from certainly decades of research, quite frankly, and experience, that if we are going to better serve that population, in fact, there's very specific literature on this point that says when we attempt to address responsivity needs, the one need that should be prioritized is the housing status. There's very specific literature on the sequence with which you address responsivity needs. And responsivity needs are things that don't cause crime. People that are unhoused don't necessarily commit crimes, but many people in the criminal justice system who, again, been there for some period of time, as I said before, have significant histories. So every resource, every ability to better address that particular responsivity need is needed and is well served. So I compliment the focus of this webinar. I regret that I won't be able to stay on to watch the balance of the discussion, but I'm looking forward to reviewing the tape. But again, my compliments to these efforts. It's in a very important, and again, to repeat Brenda's word, foundational to better serving this population. So I could talk more about it, but I have to cut myself off. So with that, I'll give it back either to Brenda or Thomas, and I have to say my goodbyes at this point.
Thanks, Mac. We'll let Thomas pick up from here. He runs the show.
Thank you all again.
Thanks, Mac.
Thank you, Chief Jenkins. Much appreciated. It's something that we should always keep in mind. And so on the next slide, this is the final in the series. So really, thanks for joining us, everyone, throughout the series. But also for folks joining us for the very first time, we will have a follow-up email with slides, linked to recordings and our technical assistance worksheets that we've sent out, as well as links to all of our previous sessions. So you might have missed it in person, but always got the recordings and the slides to share. So on the next slide, and so tying all the pieces together, and as Chief Jenkins mentioned, really being responsive to people's needs and risks is our final section of the report on support. So on the next slide, again, encompasses all of the key challenges that intersect with this area that we've mentioned again and again. And on the next slide, specifically, we're talking about increasing resources such as rental assistance, pulling together what we can, and also leveraging leveraging supportive services through avenues like Cali that you'll hear about today. And on the next slide, at a glance on actions to take locally. Again, this is about trying to do what we can to increase rental assistance to help support people get into housing. Partnerships that we've emphasized again and again and again, such as those of public housing authorities. Also incentives of landlords that we touched on last month to try and open up additional units on the private market for folks. As well as Kelly, that we heard from Riverside in webinar 3, and you'll hear from DHCS today on what benefits are coming up for folks with justice involvement. They'll be going widespread throughout the state come January. And with that, on the next slide, I will turn it over to Wayne Garcia, who's filling in for Doug Bond today and folks at Amity. Really glad to have you with us today.
Thank you, Thomas. Thank you, Brenda, for inviting us to this webinar. Wayne Garcia, I'm Chief Operating Officer of Reentry Projects for Amity Foundation. Amity Foundation, we are committed and dedicated to assisting individuals coming out, not only the state prisons, but the county jails all through California. Currently, we are truly invested, Amity Foundation in California. We currently have 19 prison projects, 3 Division of Juvenile Justice projects, a large stop placement in Los Angeles County, which is the largest county in the state, which has the most parolees and individuals coming out of the county jail. And then also with community campuses, both in Los Angeles for male and females, and in Vista in San Diego County. I'm pleased to announce that we do have 4 experts that will be speaking on behalf of Amity. Alan Richards, who is our project director, Rosalind Davis Weiss, who's our manager, and two of our experts, Jose Avina and Mr. Marvin Sanders, our experts at this, who will be giving a testimony at this. So with that, I will answer any questions later. I do have over 27 years experience dealing with the criminal justice population coming out of prisons and county jails throughout the state. I have worked for a number of years with Doug Bond, even before I came to Amity in Sacramento with CDCR and CCJBH on this important matter. Also, I just want to say everything that Chief Jenkins mentioned is right on. We've come a long ways, but we haven't come far enough. We still have a little ways to go. So we got to keep raising that bar to provide the support and the services for all that we serve. So with that, I'm going to turn it over to Alan Richards. Thank you.
Thank you, Wayne, and good afternoon, everyone. So, not to take up too much time, because we really want to allow the folks that have joined us from our organization, who have the lived experience, who have received the subsidy that we're going to speak to momentarily, and how that really has played a prominent role in helping them to, progress and move forward. So yes, Alan Richards, actually, since I guess we sent the information over, I am now the Los Angeles Regional Administrator for Amity Foundation. And also, I just want to make mention that Joanne Sanchez, who's also listed on the screen, as you see, she has joined the call. She is also a title change there. We have taken on some other additional roles in Amity. But the one thing that I want to speak to in regards to the projects that I've been privy to help out in, joining a collaborative effort under the Corporation for Supportive Housing, where a flexible housing subsidy pool was able to really, circumvent all of those areas that folks may have to go through to get, funding through other sources, other federal agencies. The current that we are utilizing a subsidy under right now is the Adult Reentry Grant to the Board of State and Community Corrections. It really is making it easy and feasible for individuals returning to our community from incarceration who've served these lengthy sentences to be able to get the housing that they need re-entering community to help them stabilize and then move forward. And so it is really a blessing to have this rental assistance that is being provided through these different entities to help the folks that we help on a daily basis, you know, folks just like myself. So without further ado, we do have the project manager, Rosalind Davis Weiss, also on the call, who is heading up the adult reentry grant. And I just want her to kind of like give a few numbers on you know what we've been able to do prior to the two folks that have joined can give a little brief explanation of what the subsidy has helped them to do. Rosalind?
Hi, good afternoon. Thank you, Alan. It's so nice to be on this call. I would like to say with the adult reentry group, we have basically housed over 200 persons in their own first-time apartments, as well as individuals that are income is not as quite as an individual who have, I would say, employment. Their income is on the status of Social Security. We've been quite successful to get them placed into their shared placement locations, and that's their permanent housing, and they're very thankful for that. One of the representatives that will speak on behalf of placement, he is at one of our shared locations, Mr. Jose Avina. So with that, we have again housed well over 200 persons in their first time ever apartments. The most gratitude I can see right now with the ARG is the family reunification portion. Individuals are able to go home and reunite with their families and reconnect and rejoin. We've had individuals to get married as well on our adult reentry grant. So as we trudge forward to get this done, I would like to say we have a total of over 300 persons that are shared in their scattered site, own apartments, permanent shared living, and this adult reentry grant is what was absolutely needed in our communities. Thank you.
With that, we'll have Jose share a few words in regards to how things have gone for him. Jose?
Yes, definitely. Jose Avina here. Thank you for allowing me to be here and share a few words. I know I'm short on time, but so much I've received since my, coming out of incarceration. I'm coming up on 3 years this June, and I want to thank you all at Amity for giving me this opportunity. I went from transitional to the opportunity of having a choice of either getting an apartment or shared living. I chose shared living because it was cheaper and it allowed me to save money a lot quicker. And in the midst of all of this, I was able to continue in attending my college and working full-time as well. So, and I'm still there saving my money. I've graduated. I got my degree. I'm a certified counselor. I have a great job at Homeless Healthcare LA. And today, and I was able to do this while I was housed at one of the shared livings. And today, I have a bank account, with a significant amount of money. And I'm in the midst of purchasing a home. So I'm thankful to Amity for allowing me that opportunity. It's great. I feel comfortable, no stress, and it's really allowed me to transition back into society, especially being able to be on my own now. So thank you guys, and thank you for this opportunity for sure.
Thank you so very much, Jose.
Yes, definitely.
Yeah, I'd like to give Marvin Sanders an opportunity to share for a few minutes. I do see that Kiera Newsom, one of the recipients of the ARG subsidy, has joined us. So we'd like to at least give her a couple of minutes also. So we'll take Marvin and then we'll take Kiera.
Hey everybody, Marvin Sanders here. So as Brenda mentioned, this program, more specifically ARG, has been foundational for me. It's given me the opportunity to obtain housing, which I had never done prior to this program. It also gave me an incentive. I came out of prison 3 years ago. I didn't have a plan. I didn't have a job. I didn't have skills. And I just didn't have any direction as to how to obtain housing, let alone how to obtain employment. So what this program had done for me is it put me in a position where it gave me an incentive to complete transitional. Then I went on to sober living. I was able to obtain employment. So once I obtained all that, it was time to move into independent living, which is the phase of getting your own place, establishing what it's really like to be in the real world, be a tax-paying citizen and so forth. So I was able to connect with ARG, more specifically with Zola, Miss Rosalind, and Lisa as well. And they geared me and placed me in a position where I was able to understand the value of having my place. I lived there. I got the grant to help me with my living expenses, rent, and so forth. And it built this momentum for me personally that I wanted to be able to have this. And it wasn't short term, it was something that I had control over. So I was able to continue on with the lease. Once I completed the lease, Jose had mentioned about purchasing a home. So I did some research and found out that you needed 2 years of employment history. I found out all of the prerequisites, if you will, to buy a home. And I made that transition, and ARG allowed me to save. So I had the savings, and I applied the savings towards purchasing a home, which I now own in Lancaster, California. And it just gave me so much that I've never had prior to being released. I didn't have anything. And now it's just so fulfilling to see that this program has put me in a position where I'm able to have all that I have today. So I say that I'm continuing to be motivated, encouraged, and it lets me feel that staying on this path, which is the right path, it comes with a prize, and the prize is just having that financial independence and ability to just live my best life. And to kind of sum it up, I am currently a employee and a staff member of Amity Foundation. So everything came full circle. The same individuals that helped me along my path, the same ones that put me in a position to be a homeowner, to be, a tax-paying citizen, are now my colleagues, and we work side by side every day. And I pass on my knowledge and my abilities and everything that I've learned from the program to people like Jose and other individuals who want to better themselves and who want to really take advantage of this opportunity and to put themselves in a position to be where I'm at today. So thank you guys all for being here today. Thank you, Rosalind, Alan Richards, and everyone for having me. Thank you, Thomas.
Excellent. Thank you so very much, Marvin. And last but not least, we want to make sure that Kiara Newsom, who has also been a recipient of the subsidy, give her a few minutes to share. So thank you, Kiara. We heard what was going on with your family. Thank you for joining us.
You're welcome. I felt like this was important as well. And I would like to thank you guys for having me here today. And I just want to share something with you. When I came home after 19 years and 10 months, I ended up having a brand new baby. I'm freshly married, and we were really struggling with finding housing. We were. So when I met Miss Rosalind, she gave us the opportunity to find our own place. And also through the program Amity, we were able to not only get the place, but they paid the bigger portion of the place. And then she was so kind enough to come in the place and let me know what all I needed to get fixed and what needs to be done, what the landlord needs to do to the place, and that made me feel so comfortable because she wasn't just giving me the money and the program. She was actually helping me and teaching me things about a place. This was my first place. I was 17 years old when I first went into the system and was incarcerated. So that was a beautiful thing for me. But not only that, she also allowed me throughout And I was able to save money that I would not have ever been able to save. And it began to allow my husband and I to become self-sufficient. So when it was all said and done, we were able to save enough money to have money to go on to the next level. Now, we thought about purchasing a home and different things like that, but there's a few other things we have to do, because coming out from 17 to 38, I don't have any credit. I had to build credit all over, well, not all over again, but basically for the first time in my life. So I'm learning things as I go, but Amity has been a great help. And I'm gonna miss this opportunity for Ing to thank the people there, especially Ms. Roslyn, for helping me along the way and helping my family and our brand new baby. And I just want to say that we are so grateful. Thank you for having me.
Well, thank you. Thank you very much, Kiera. So with that being said, I want to just thank all of you for the great work that you've done in lieu of, establishing your new chapters in life. You're definitely, examples to us and everyone else in regards to what can be done with subsidies, rental assistance and services for individuals like ourselves who are returning to communities, from incarceration. So, I commend you. I tip my hat to you. You are the epitome of success. And I just thank you for allowing me and Amity to be a part of your lives. And with that, that'll conclude our little presentation, and we'll turn this back over to Thomas.
Great, thank you, Alan. Thank you, everyone at Amity.
Thomas, this is Wayne. Can I just add one thing to this?
Of course.
Yeah,
Wayne.
first of all, we're very proud, but in years, as I mentioned earlier, been doing this quite a few years. And in years past, we had so many individuals coming out of prison that were so committed to changing their life. And what would happen as soon as they got to the door to leave either prison or from a recovery campus, life showed up and they had nowhere to go. And, and they were sincere in changing their life and wanting a new lifestyle and reunite with their loved ones and family. But because of a lack of opportunity of housing, a lot of them, unfortunately, did have to return to custody, recidivism. This is a wonderful opportunity for all that we serve. I mean, what a wonderful testimony by Jose and Marvin and Kiera, especially they're talking about buying homes, and Jose's buying a home. This was unheard of 5, 7, 8 years ago. But today, because of the programs and the support that we have in the community and Amity Foundation and our partners, we are so delighted to present this and show that change is possible. So hats off to everyone that spoke. Thank you. And once again, as I mentioned earlier, we still have a little ways to go. So thank you.
And thank you, Wayne. I just like to make this one mention just to say that part of the ARG program, the amount of monies that they're saving is according to their income. So that allowed them up. The faculty of the ARG staff, we verify that those amounts are being saved each month, which is moving into the ability for them to self-pay after the ARG project has come to an end. So I too would like to say kudos and thank you. And we could not have done this job if you students would not have carried out standing. Thank you.
Yes, thank you, Rosalind. Thank you, Wayne. And really, that speaks to everything you do at Amity and people's dedication to their own lives. And yeah, also the opportunities that rental assistance and supportive services like Amity is providing really open up for folks. Really so wonderful to see how people have done that. Now we will, on the next slide, we will turn it over to Dana with DHCS to join us on CalAIM, talk about some of these supportive services and opportunities for additional services that will be coming up in the upcoming year. Oh, and Dan, I'm sorry, you're on mute.
On mute. I do that all the time. Sorry about
Same.
that. I will say those stories are really hard to follow. I mean, it is amazing to hear all the great work that y'all been doing, and really the lives that were impacted. So I appreciate the ability to hear from Jose, Marvin, and Kiera. It just really kind of is amazing. We hope that we're able to do stuff like that in people's lives in Cal-AIM. That's the overall goal. So I'm going to talk to you about enhanced care management and community supports, and how we're really working to do some more integration and support of people. So next slide. So what Cal-AIM is it's California Advancing and Innovating Medi-Cal. And it really is kind of taking the older model. I don't know how many of you are familiar with Medi-Cal, but in general, it's taking the old model of Medi-Cal, which was mostly reactive and has been, and really focusing a little bit more on prevention and coordination, because oftentimes it's really hard if you're not used to being in a system to get connected. And once you get connected, we want to make sure that one stays connected and that their care is coordinated at a pretty high level. And so with that, I'm going to have someone, the next slide, please. Cal-AIM is what we're doing that with. And so Cal-AIM is this really multi-year initiative that we're undertaking. And our goal is to improve the quality of life and also health outcomes of those we serve by really changing the delivery system overall and changing payment in ways that really kind of focuses on prevention. So we're using Medicaid as a tool to really help those who have really complex challenges facing our most vulnerable residents, and really look at them as people instead of health conditions, and really target not just the health conditions, but the things that lead to the health conditions. And we're calling those social determinants of health, or really we're kind of changing to social drivers of health. And our hope is to reduce some of the health disparities and inequities that people have faced over time. Next slide, please. And what we're doing in doing that, we've got some pretty good goals out there. The first one is to really identify and manage member risk and need through these whole person care approaches by using the social drivers of health. And then another thing we're doing is we're working to really make Medi-Cal more consistent by reducing some of the complexity and making coverage overall a little bit less complex and more flexible. And then finally, we really want to improve quality outcomes, reduce health disparities, and drive delivery system transformation through really the way we do incentives. We want to modernize systems, and we want to put payment where it needs to be, which is making sure that people are cared for and that their systems in place to help. Next slide, please. Next slide, please. So one of those ways is through really focusing on care management. And care management, I'm going to kind of go down up on the pyramid so you understand it. And care management is really how we make sure that someone's care is managed overall. It's kind of exactly what it says it is. And so the basic part of care management would be for anyone who doesn't really have a whole lot of health needs, and they don't require a lot of support, but it is intended to help those who have some needs with planning and coordination, but it's not very complex. But if someone gets a little bit more complex in their disease process or in their risk or their conditions, there's complex case management, and that's really intended for people who are a little higher at risk and they need coordination for multiple complex conditions or episodic needs. And so if you're facing a health condition and you have a lot of follow-up, or you have a lot of physicians or health providers that you're seeing, complex case management is meant to help coordinate all that so you don't have to coordinate yourself. But we're adding on, and we've added on this higher level of care, and that's called enhanced case management. It's really intended for the highest risk members who need long-term coordination for not only multiple chronic conditions, but also social determinants of health or social drivers of health. And they're utilizing many service types and delivery systems. So you can have needs for housing, can have needs to get your social services coordinated, all of that stuff that is going on in one's life. That's what an enhanced case manager should be doing, is coordinating across the spectrum, or that's what they're intended to do. Next slide. And with that, we also have something called community supports, but let me just go over again what enhanced case management. It really is a benefit in managed care. So if you're in a managed care plan in Medi-Cal, you have complex conditions as well as social conditions, you can have and you meet one of the populations of focus, which I'll go over in a minute, you can have a enhanced care management, and that's meant to address the clinical and non-clinical needs of someone through really coordinating the services and managing the care instead of letting the care be managed or being managed by the care. And one thing that we've used as a tool for the toolbox of that case manager is something we're calling community supports. It's really known as, it's in lieu of state benefits, or as the federal government calls it, it's in lieu of services. And these are services that Medi-Cal managed care plans have the option to provide in lieu of something else. And they're really used to help keep people in the least restrictive environment possible, or that they want to be in. So instead of like maybe going to the hospital or going to a skilled nursing facility, or having to use the emergency department, community supports are intended to put people in a place where they have more freedom to live in the community and be as independent as possible. So in general, what these ideas were born out of was two programs that we had prior. One was called Whole Person Care, and that was run by our counties. And the other is the Health Homes program, which was run by our managed care plans. Next slide, please. And those two were done through an initiative that were really pretty good programs, and we thought they were good enough that we'd carry some of those lessons that we learned over and make sure that they're available throughout Medi-Cal, because one of the problems with those two programs were they were just in certain counties. So some of the great things that were done in those programs have kind of formed the core services for our enhanced care management. And those things are listed here. So some of them are really that comprehensive assessment and care plan, really working to coordinate and refer not just to your medical appointments, but also making sure that you have access to the community overall. That enhanced care coordination, really making sure that the member and family are supported and have some support around them, as well as people who are important to the member. Promoting health overall, making sure that as one person transitions from one situation or setting, like from a hospital to home, or from a skilled nursing facility to home, or an intermediate stay of some sort, making sure that the care manager is really involved at that point. And finally, outreach and engagement. Sometimes you may have some issues that are making you a little bit harder to be engaged, and that enhanced case manager is going to go and make sure that they're in touch with you and that you know what's going on and that you have someone you can call instead of having 20 billion people who are working with you. Next slide, please. And these are the counties that went live in blue, purple, and dark blue in January of 2022. But all of California goes live in July of 2022. So just kind of give you a sense of where we are now and where we're headed. Next slide, please. And this is our implementation timeline. As I said, we're going live in all counties in July of 2022. And the populations that we're really focusing on for our initial go live are those experiencing homelessness, those who are high utilizers of medical services, adults with a serious mental illness or substance use disorders, or those who have been incarcerated and or transitioning to the community. And the reason that incarcerated and transitioning to the community is in that first population is because there were some whole person care entities that did a really good job coordinating some services that were in reach and then help someone as they were transitioning out of incarceration. And we didn't want to lose any of that intentional infrastructure that was built or those connections that were made. So one of the things that we did is if that was there, we're doing everything we can to keep that going and to make sure that it is really, we don't lose any of the ground that was made. Also, starting in January 23, we'll be starting up parts of our incarcerated and transitioning to the community in all counties. The reason we didn't start that earlier is because we're really working to make sure that we're pretty coordinated overall. We want to make sure that there's an infrastructure that works in the system to make sure that there's some services before someone is released from incarceration, but also that that person works with the managed care plan or whomever needs to be worked with so that there can be services coordinated on the outside. Because as someone comes out of incarceration, it's very easy to lose some of the inroads that were made when they were incarcerated. So the goal is to make sure that there's a system that helps and really buttresses up the availability of that coordination so that anything that's been done can continue to be built upon, and we can see people who are given that help that they need to really continue to grow and get to where they need to get to. And finally, in July of 2023, there'll be a focus on children and youth. And we're waiting on that a little bit longer because we want to make sure that we're intentional in doing that as well. Next slide, please. Now, I talked a little bit before about community supports, but I'm going to just add a little bit more onto that. They really are supports that are focused on addressing medical and social determinants of health and avoiding really people having to get higher levels of care, and that care is usually a little bit more costly. So these are medically appropriate services that are provided to stop someone from going into a nursing facility or using an emergency department. A couple things to know about those services is they're optional for the plans and they're optional for the member. So if you don't want to take a community support, you don't feel like that's the right thing for you, you certainly don't have to do it. They have to be medically appropriate as well as cost effective, and they became available statewide on January 1st, 2022. But community supports can be added every 6 months. So in a couple of slides, I'll show you the chart of where they are and kind of where we're headed, because they didn't all start at the same time. Next slide, please. So there are 14 pre-approved community supports. And I'm going to have you go to the next slide because I'm going to talk about them really quick. Some of them are focused around housing. Those are kind of a bundle of sorts. Housing navigation, getting into and finding housing. The next part of that would be actually paying for the deposits for housing. And then finally, making sure that someone, once they get into housing, has tenancy support and sustaining services. So that's kind of a suite that many of the plans are offering, but they don't have to offer them all three, but many of them are. And then there are some that are really meant to kind of keep someone, give them a place to recover before they go out into the community. And that really focuses on our short-term post-hospitalization and our recuperative care. And that's kind of a place where you can get some support, but you don't need the medical support that a hospital would bring. So this is a place that really kind of heads you out more into that community, as I was talking about. And then there are respite services, and those are services that are aimed to really make sure that someone is supported as their caregiver may need a break. And sometimes caregivers have a lot going on. So giving them a break for a while so they can continue to be caregivers is a really good way to go. So that's why we've offered that one. Also, the day rehabilitation programs, as well as nursing facility transition and community transition services. Those two are taking someone who is in a setting such as a nursing facility or might be at risk for going to a nursing facility and making sure that we give them all the supports possible for them to be able to live in the community. Another one that really supports, or another three that really support someone being independent in the community, is really sometimes a person may need personal care and homemaker services. That need may actually be above someone's IHSS support. And if it is, there's a way that a plan can go, okay, you need a little bit more. We're going to make sure that you're helped. Or if there's a gap before that IHSS kicks in, the plan can work to make sure that that's covered. Additionally, a couple things that help someone stay in a home, or if there are environmental problems or home modifications that's needed, like you have a wheelchair and you can't get into your house. Some of the plans have taken up that home modification, and so they'll build a ramp or do something that would help enable someone to stay in the home. And finally, medically tailored meals or medically supportive food. And those really are foods that enable someone to get their nutrition that they wouldn't otherwise be able to get. And that's really important in being able to keep people independent in a home. There are two others on here that are really things that are exciting that's happening. Submarine Centers, which allows someone to divert from either going to the emergency room or to jail just because they're intoxicated. It is a place you can go and get care for under 24 hours so that you can get sober and kind of get back to where you are. It's a safe place, and we're really excited about that. And finally, asthma remediation. It falls in the bucket of keeping you in a least restrictive setting, but some people have really bad asthma, and making sure that the air's clean and the appropriate filters in the house, that one's what that is intended for. So just wanted you to be able to see all of those community supports because we think they're really important. Next slide, please. Here's a list of those community supports and the dates that they are up and running. They're actually on our website, and we'll make sure you get a copy of that if you want a copy of that. But as you see, the reason I have this so small is so you can see how it's rolling out through the states. Either that, or I want to see how good your vision is. I'm not really sure which of the two. I see some of you putting on your glasses, so I guess I'm checking your vision. But anyway, the goal is to make sure that you see that we've got a lot of plans who are really involved in this, and it really is throughout the state. So you'll see the first column is county. Go ahead to the next slide.
Dana, this is Brenda. I just want to let you know I popped the community sports by managed care plan link into the chat for everybody, so you don't have to do the glasses thing.
Thank you so much. I really appreciate that. But every county is kind of listed on there, and it tells you what's going on with every county. And I do encourage you to look at it. And I'm so glad I have Brenda who put that in because it's important to know.
I use it all the time. That's why I had it handy, Dana.
This next part I'm going to go over that tells you kind of what we're doing from a big systemic level. But part of you is going, how does this impact me? And so these next points of consideration, and I'll have you go to the next slide, kind of want to focus a little bit on how these two things really impact with the justice components. And first of all, we are working on really building capacity for the justice involved. and working with counties as well as state institutions so that we make sure there's capacity to work inside institutions so that people can get care before they're even released. And with that, if you have not heard of that and you're with a county or know of someone who is not involved yet or just want to read more, I put that information about our first round of grants for that into the slide deck so you can see it. But we're really excited about that. There are 4 rounds that are going on, and it really is to make sure that there's a lot more information exchanged, that there are services that are available, and that there are connections made, because there's not as many connections as we need to be between the justice community and Medi-Cal, and we're making sure that we're doing what we can to build those up. And with that, I also want to talk about InReach. InReach is one of the most exciting things I think we're doing. And that really is to make sure that as someone is in an institution and looking at that they might be headed towards release, that they are given some ability to really get assessed for what's needed and start to make those connections. And that's what happens in InReach, and really is a component that is foundational of us believing that we can make some of the difference that was made in the slides that were presented before, because that's our goal, to transform people's lives. And another component of that is really doing a streamlined managed care enrollment. So if someone has been enrolled previously in a managed care plan, that enrollment will be, we're still working out the total, all of the details on how it happens, but that enrollment will be paused and they will be put in the same plan as when they come out. And or we're finding ways to make sure that if someone has a choice or has some things that they want, that they're seamlessly released from incarceration and in a managed care plan as they come out, so they're not having to hunt for someone that they go to or resources, that there are people who can help with those resources. And the InReach actually has an outreach. It's not called that, but that's how I like to think of it. You get that InReach, and then you're connected with an enhanced care manager in a managed care plan. And so you have that kind of seamless connection so that that person will know what happened to the person while they were in an institution, and that connection can be made so that those needs continue to be fulfilled and you don't have to tell your story 100 times. And the goal is that we have people who've already interacted, such as you guys, with those who've been incarcerated to help navigate the system, because it is a system in which there is a lot of needs, and having experience with someone who's gone through that process and or having lived going through incarceration, really you understand in ways others couldn't. Then there will be coordination in fee-for-service as well. We're making sure that our people who are assigned to help in fee-for-service if someone chooses not to go into the plan, but really that enhanced care management is really an important part of what we're doing. Adam is asking a really good question for if there's a community support that is not offered, why didn't it happen? Great question. Well, there are a couple of reasons. One is it's totally a plan option. So in lieu of services, the plan chooses to do it rather than it's a state benefit. So with ECM, it's a benefit that is offered by the state. And if you qualify, then you get offered it no matter what. Within lieu of services, the plan can choose to offer it or not. And they have to look at whether it's cost effective and whether it's medically appropriate. Now, we do have a community supports policy guide, which really kind of walks through all the details of all the community supports. I did it at a very high level. But part of the reason that we've chosen to offer it in lieu of services at first is because the infrastructure isn't statewide. As you saw that map that I put up, it showed just counties where it was focused. And as you look at things, that's where the infrastructure is currently, where those where the colors on that map were. So we're working really hard to build up the infrastructure overall. And once we do, our hope is that many of these community supports can become benefits and be offered statewide. But when it's a benefit, it has to be available. And we just don't have the infrastructure statewide to make it available yet, but that is the goal. I do not know the answer to your question, Kelsey, is what is the criteria to determine those who are vulnerable, the vulnerable institutionalized? So that's on here. It's a great question. I see that now. It really is those who have been identified when they were incarcerated and given support. And that group that is the Justice Involved Initiative really is defining what the criteria is for that now, and it will continue to evolve. But it really is those who are going through some vulnerabilities as they're and some health concerns, as well as some social perceived social concerns as they come up. And if someone wants that support, they will be given that support. And it sounds like Brenda may want to add to that.
I was just going to say, Dana, maybe the ECM assessment might be.
Yeah, that's a really good point. So as you look at someone and see if they're they will be given an assessment to see if there are needs. And if there are needs, it's a pretty liberal assessment because the goal is to coordinate things at almost any way that they actually need coordinated. So I hesitate to say this, but I think the goal is to make more people who are even close to being vulnerable part of the ability to have ECM, because there is such an ability to fall through those cracks. And the goal is to make sure that no individual falls through those cracks. So Kelsey, I hope I kind of answered your question. And how will the changes be communicated to the folks who are incarcerated? Well, that's why we're working with the counties and state institutions at this point to make sure that there are people doing that in reach currently. Or will be soon. They're not doing it currently, but we're planning for that. And that's why we have the roundup grants and are really doing the communications so that we can plan not just within Medi-Cal, but with the county jails as well as the state institutions to make sure that we ask the right questions and are all on the same page. What's needed as far as systems, what's needed as far as someone who does in-reach. Are we making sure we ask the right questions? Are we making sure we look at the right information? And those are the things that are happening now as far as really having that conversation so that we can make sure that those changes are communicated to those who are experiencing health concerns and are looking at going into the community. What is the criteria and who determines the cost effectiveness in terms of eligibility? Is there a yearly threshold of monetary expenses that would allow someone to qualify for certain plans? So Brenda was nice enough, as well as Thomas, to put in the link for the policy guide. And that really defines just the bottom that we've negotiated with CMS, that those different community support offerings are presumed to be cost effective. And in general, they are seen as cost effective. Now, there can be some instances where a plan may determine as a group that may not be cost effective, but that's why they've chosen not to do it. But in general, if someone meets the criteria in the policy guide, they should be eligible for the cost effectiveness. Thank you for defining CMS, Thomas. And is there a monetary threshold? For many of them, they're not. There are for a couple, there is a monetary threshold for the home modifications and for and that's $5,000, and that's over a lifetime. But in general, there are not any monetary thresholds that would allow a person to qualify for a community support. And in Medi-Cal, everything's free. If you qualify for Medi-Cal, you cannot be charged any money for anything that's given to you. And that includes those community supports that I went through. But as far as what the plans could pay for things, there is that one monetary threshold, but we are looking at that, because as we look at it, and if that's not enough to actually cover it, we will raise what is available to be spent. And so Adam's asking if the county determines it's cost effective. Well, the managed care plan does. So it's not run by the counties, but it's run by the managed care plan in each county. And there are some counties in which there are different offerings by managed care plan. And if they determine that it's not cost effective, they don't have to offer it. But if they do determine that it's cost effective, then they have to tell us what they're doing with it, the department, and we approve that. And if someone would potentially be eligible for something, but the plan has chosen not to do that, then the individual will be eligible for what service that is part of the state plan that would be in lieu of or instead of. And that really is the way that that's looked at, but we are really pushing the community supports because it really is consistent with everything that we do, which is get people in the least restrictive setting possible. And Kelsey's asking if enhanced care manager positions are housed in local counties. So the enhanced care managers are usually they're contracted individuals or organizations with managed care plans, and they really are supposed to be community based. So the plan can't just have people that work for the plan who are sitting in an office and not accessible. It has to be people who are actually in the community. And as I said before, and I don't know that I can stress this enough, it needs to be people who have experience in the particular population of focus. So if you've never worked with the incarcerated population, that is not who the plan really should be working with, to work with the incarcerated community, because it really is that specialized focus that we have. So if you're interested in working with the plans to be an enhanced care manager, really should be part of the conversation overall. And they haven't really gotten to the point where they're doing enhanced care managers or signing contracts with them yet, because it's a little early for the start date of January of 23. And we've got some other kind of times that guard that, but there's another initiative that you want to kind of continue to track as well as this, which is our PATH fund, our PATH grant overall. And it'll offer some training to be able to help those who you probably previously worked with, but to have some specialization in understanding the medical world. Like, we have weird things about how we bill, and we use codes and things like that. And there'll be training through our technical assistance marketplace to really learn those things. And that training will be available starting really in the third quarter of this year. So just keep your eye out for that. And I'll make sure that I keep Thomas and Brenda apprised of when we get to various places, and Brenda's going to say something, which is great.
Yeah, no, sorry, Dan. Also, just because I've been in conversations with the team, as DHCS team as well, and they've got the, for now in the interim period, there's the incentive payment program funds, which managed care plans have access to right now to build out provider capacity. And that could be something that providers could approach their managed care plans for, to talk about. So I can pop that into the chat as well, if folks are eager to get conversations going sooner rather than later.
Another thing which I'll point out that's part of the incentive payment program is the plans looked at the county and said, this is where we have gaps. You know, I don't know how well they did at really looking to lay at the gaps in the justice area. And we're going to be making those gap filling plans available online. They're not yet, but I'll let Thomas and Brenda know when they are. And would encourage you to take a look at those. And if you see holes, we're going to have the managed care plans go back in and kind of fill that out. And so really want to make sure that you're aware of that and know that that's happening. But that's part of that incentive payment program as well. Great. And next slide. We also have another program that we're really excited about, which is our Housing and Homeless Initiative program. And it really is a program that we're doing that is helping the managed care plans really work on investing funding for housing and making progress in addressing homelessness, but also keeping people housed. And as you probably know, every year, the county or another government entity submits what is called a local homeless plan. It's called a HAP. And they submit it to the DSS. Well, we're taking that basic homeless initiative plan and we're having our managed care plans work with them, with the county, to develop ways that the managed care plans can work with that HAP or the homeless plan for the county or the local entity and talk about strategies they can work with their enrolled population that sync with that overall government entity plan. And so the plan must outline how they're going to use the services and supports and really be integrated into the homeless system overall. And then they'll have metrics, and those metrics will, on top of that, really be focused on getting people housed and keeping them housed. So there is a plan to make sure that those who are not currently housed have ways to be housed and retain that housing throughout our the incentive program for our housing and homeless. And the link is on here and we'll show you that to you later. Next slide. And there are more links on here, and would love to kind of answer any questions you may have about CalAIM. We're doing a lot. So as much as I've been able to kind of go over it, if you're interested in any of what we're doing, we really value your voice. So would love to hear your thoughts on things, as well as if you're not involved yet with the managed care plan and or the justice initiative, we would love for you to get involved, because it only gets better when we have more people at the table, because we hear those different perspectives and it makes us go, I didn't think of that. I've got to get it really thought through, and we've got to make sure that we do this right, because we're doing this because we want to make some investments in lives, and really appreciate your time and really hope we can partner with you going forward.
Thank you so very much, Dana. It's really great information for everyone today. I see some questions on if we will share slides, and absolutely we will. We'll also share anything that Dana sends along to us as well for everyone to have. So on the next slide, I will pass it over to Whitney and Danielle to talk about flexible housing subsidy pools. Thank you so much.
Thank you so much, Thomas. Hi, folks. I'm Danielle Wildcrest. My pronouns are she, her, and I am going to be presenting with Whitney Lawrence today. And you'll notice that it says I'm a chief of staff for the Arlene and Michael Rosen Foundation. That is true. But today I am here with Whitney under the auspices of the Changewell Project. And I want to give a shout out to Elena Fialo and also Rebecca Watson from Changewell for their leadership to help us develop the flexible housing subsidy pool guide, which I'm going to drop the link into the chat box there. Next slide, please. Oh, next slide. Great, little repeat there. So the Flexible Housing Subsidy Pool Guide, I would say, if nothing else that you're taking away from our short conversation here today, is that there is this resource available online. It's really aimed at funders, especially government funders, but I think that it's really interesting for anybody who's interested in scaling supportive housing. And it covers everything from high-level contract structures, like the nuts and bolts, down to even staff positions and staff roles, both within government and within nonprofit partners. We're really lucky that some key partners in Los Angeles were willing to share sample contracts. We have some board motions, as well as some templates that you can literally just like copy and paste to enter into our property agreements to implement a flexible housing subsidy pool. So again, please, if you hear nothing else, go to this website to check out the guide. Next slide. So what's a flexible housing subsidy pool? Well, it started in Los Angeles County. That's where I'm based, and so is Whitney. In 2014, the Los Angeles Board of Supervisors had strong leadership, and at the same time, there was strong leadership at the Department of Health Services, who's the primary entity who controls the flexible housing subsidy pool in LA. I wanted to just for this audience note that one of the great things about the Flex Pool that Whitney will talk about is that you can collaborate across funders. In LA, one of the things that we've been most proud of is that our Flex Pool has done a tremendous amount of work with the Office of Diversion and Reentry. Alan was kind enough from AMI to give us a little shout out at the beginning. That has included investments from the LA County Probation Department and a lot of key work with the LA Sheriff's Department. So the Flex Pool is a broad structure, and we'll emphasize that a few times, that can be used to work with a whole bunch of populations. But one of the populations that we're really excited about is folks who have a touch to the justice system. So it started in LA, but it's been replicated in a number of communities in different ways. There's one in the Inland Empire, Sacramento has one, San Diego, San Francisco, Chicago, but LA is considered sort of the gold standard. And so another way to think about the guide is that it's essentially a case study of the LA model. And since it was launched in 2014, over 10,000 folks have accessed permanent housing, the majority of those folks having had experienced chronic homelessness. Next slide. So what is it? It's a nationally recognized model for scaling supportive housing. At its core, the Flex Pool is procurement reform. I know you're so excited about procurement reform, but it's real that if you are able to, as funder, really streamline and simplify your contracting contracts, build out a set of partnerships, that is the key to really bringing a lot of supportive housing online. It is not a housing program. So a lot of times when Whitney and I have given presentations, folks really want to talk about programmatically. We can go out and work with landlords. We can do, this is what the supportive services look like. And while those things are important, those are programs, and the Flex Pool itself is really a mechanism to bring a whole bunch of programs under a streamlined umbrella for getting money out the door. Next slide. We like to say that a Flex Pool is really a state of mind. So when you're doing Flex Pool work, like I said, you're really looking to simplify a contracting process so that lots of community-based organizations can do their work well and really focus on finding housing, helping people access housing, supporting folks in housing with a lot less admin burden. And then it really shifts the funder's role. It's in management of relationships. So in our world, working on homelessness, there's a lot of talk about housing first, which has mostly been about how a provider interacts with somebody who might be experiencing homelessness. We're saying that housing first really needs to start with the funder, and the funder taking on their responsibility to remove barriers in the system that really are impediments for providers and also other participants accessing the housing they need. So at its real core, we believe that it embraces an equity framework, and that it sort of engenders a way of doing a business that embraces trust and abundance, so that we really can do something like get 10,000 folks off the street in relatively short order. So I am going to go ahead and hand it over to Whitney, and she's going to give you a little bit deeper dive into some of the key things that we'd love for you to take away. Whitney.
Cool, thanks Danielle. I think next slide. So hey folks, I will try to keep my time brief. I think just to reiterate, please, if you take nothing else away from today, read the guide. Danielle and I poured our hearts into writing that guide. And it's been sort of our life's work for the last however many years. So it was a bit of a love letter as well. So I'm not going to spend a lot of time on this slide. You can read it. Suffice it to say, there are core program components to a housing program, to operationalizing housing, that are critical to success. And being disciplined about making sure all of those components are there is particularly important when you are taking in funding from a variety of funding sources, which is what the sort of flexible contract model allows you to do. I think specific to justice involved populations, maintaining this core service delivery package is critical to ensuring that we're protecting sort of like the most vulnerable clients that we are serving within any system, like the reentry population. Next slide. In order to successfully scale housing, your intermediary or the community-based organization who is out doing this work, who is sort of like out building that portfolio of housing, working with landlords, they need a set of financial tools to do unit acquisitions, to actually sort of like go out and get the units. The tendency of funders, particularly government funders, is to view these costs that you see here, holding fees, security deposits, furniture, eviction prevention, to view those costs as optional. They are not optional costs. They're critical to being able to compete in the private market. And again, going back to what we're here to talk about today, they're critical to making sure the most vulnerable folks in our systems have housing opportunities. Without that complete package of financial tools, it is really hard for the most vulnerable folks in our system to find the housing, even if they were able to get the housing voucher or the money to pay for the rent subsidy. We need these other tools to grease the wheels. And importantly, no cherry picking. These tools need to be consistent across all of the funding sources that can come into one contract. So next slide. Okay, so this slide is kind of the heart of it. Over the years, Danielle and I, have been asked to present on flex pools. And over time, the way we thought about it and talked to communities about it has evolved. So we used to talk a lot about landlord engagement and the specialization of roles. So this idea that like case managers should do case management work and real estate minded folks should do housing acquisitions. And that stuff is really important. And then over time, we sort of started to see that the real magic was that one contract could hold multiple funding streams. And both of those things are really amazing and they're very important. But the more time I spent in homeless service systems and in county government, the more I started to realize that the real potential of the flex pool is actually about broader procurement reform. So just to provide some context, I'm about to describe sort of this graphic to you that you're seeing, but before I jump into that, I think it's important for folks to understand that the flex pool was really only one piece of a few key contract structures that made scaling up in Los Angeles, scaling up quickly, possible. The first was setting up housing case management contracts to be based on a per member per month basis. So in short, we made making budgets and getting paid very easy for providers. It also actually made it easier for us as county administrators. So the first piece was a per member per month contract with providers, making it really simple to do budgets and simple to get paid. The second piece was an over-the-counter sort of like master services agreement. We streamlined the process by which a provider can become a vendor for the county and made it open on a rolling basis. This makes it easier to set up contracts when the need arises because you don't constantly have to put money out to bid. And it simplifies things for the providers because they are not constantly responding to RFQs or RFPs. And the flex pool was the third piece of that. One contract mechanism that can steward multiple funding sources was the other piece. So the most important thing to know about this graphic is that every relationship you see here is built on deep trust and on a commitment to let experts do what the experts are best at. So in the middle sits the local government agency, who is the main contract holder. Above them is the local governance body, which in this case is a county board of supervisors. And below the contract holder are the service providers, your community-based organizations. And over to the left are the funders. And at the bottom of the graphic, you'll see the program participant who's receiving services. So in the flex pool model, the contract holder gets delegated authority from the local governance agent board, so the board of supervisors. This authority is built on trust, but also checks and balances. The delegated authority allows the contract holder to accept funding, importantly, from new funding sources, and also gives that contract holder the permission, the authority to enter into contracts with service providers. The impact of this is that the contract holder is able to accept new funding from funders as they come available and to plug it into already existing contracts with service providers without going through the owner's process of writing and passing board motions every time a new opportunity or funder comes along. So the contract holder uses that delegated authority, enters into contracts with service providers. The real magic is that the contracts are pretty broadly written. The scope of work is appropriate, but it's broad. And the budget sits separate from the scope of work, so that when new funding comes available, the scope of work is broad enough that new funding can be plugged into the contract and budgets can be amended to accommodate with like relatively simple and low admin burden on, in this case, the county administrator. Meanwhile, and importantly, the providers this whole time are able to focus on serving the clients. They are not responsible for dealing with the funders. They are not responsible for securing different funding streams or managing the varied funding requirements, the reporting, or the funding cliffs associated with managing a number of funding streams. So here are some like biggest takeaways here. You definitely need an intermediary to do this work. Local governments cannot compete in the housing market. They are not nimble enough. We get this question a lot. Do I really need an intermediary? Yes, you 100% need an intermediary to do this work correctly and to do it at scale. The second sort of big takeaway is doing the front end legwork to get delegated authority is worth it. I'll often find when I talk to communities who are first starting to think about doing this, they see the value in this kind of model, but they feel so much time pressure because this crisis is on our doorstep. Get the delegated authority, use it, and pass that grace and flexibility on to your providers. The next two are that you should make it easy for your providers to get paid, and you should make it easy for your providers to serve clients. And I think my last point on this is the way that you do that is you do not pass the administrative burden of braiding funding streams onto the providers. Government is better positioned to do that work, especially if they're thoughtfully staffed up. Next slide. So I'll breeze over this one. As we said, the flex pool can steward multiple sources. As new funding comes in, it gets infused into the already established contract. Next slide. So important is that broad SOW. As government funders, I'm hoping there are some of you on the line, our impulse is to dictate everything in contracts and in budgets. Fight that instinct, embrace trust and embrace flexibility. It will save you so much in the long run and will result in better outcomes for the folks you're trying to serve. And stop being territorial. I think we all need to really get honest about what our expertise is and make room for experts to do what they're good at. So our example here is like maybe probation shouldn't be running a housing program. Maybe probation, we should build contract structures and a system that makes it really easy for probation to make investments into housing on behalf of their clients. we are sort of competing against ourselves and distracting nonprofits when we don't do the work to centralize some of this functionality and to create contract structures that allow folks to make these investments. Next slide, and I'm going to wrap up, so maybe we'll have a few minutes left. So you'll see our 5 key takeaways there. Those are our 5 key takeaways for any community that is thinking about launching a flex pool. But if I get to make an ask to sort of like the specific group on the phone today, it would be to think about the following questions. How can we, at the funder, state government, local government level, how can we make it easier to contract with us, to become a vendor? What are we at that level doing to make spending money easier? How do we make getting paid easier? And I think the question that is really important is, what administrative burdens do you pass on to your providers? And are they really best positioned to take on that administrative burden? And are they, oh, I'm at time. And are they better positioned than you? So I love the final point on this slide. It's really about trust. It's really about flexibility. And then the open question of like, are you ready to operationalize Housing First framework across your system? And I think we're done, Thomas, and we barely made it.
Oh, that was really wonderful. And thank you so much, Whitney and Danielle. Yeah, I think that point about trust and sharing and partnerships, that's just so very important to all of this. But especially when it comes to handing over funding from an agency or handing over some control over something that we might otherwise have a lot of felt ownership over, even though really it's the community that has it. So it's really great. We'll open it up now just for any brief questions. And if not, we will move into our resources and the next steps. I did have one question, Danielle and Whitney. When you've seen the flex subsidy pools try to move into a universality of what they're putting out rather than trying to cherry pick things, what's been one way that they've just been successful in actually making that happen?
Do you mean like, how do you make sure that the cherry picking doesn't happen?
Yeah.
I mean, that's a great question. So we were really trying to speed through here and didn't explain who we are. But in our former lives, Whitney used to be at the Department of Health Services in LA and actually ran the flex pool for the government there. And I was the nonprofit partner who operationalized it in LA, but also San Francisco, San Diego, and the Inland Empire. And I would just say that it comes down to having somebody with strong leadership in that government seat. So Whitney's very humble and she won't tell you, but she had to have a lot of tough conversations with the probation department or the Department of Mental Health or a managed care organization that wanted to invest to really help them understand why that consistency was needed in order for us to all scale. If they wanted to see the good results replicated for them that we've been seeing in other parts of the system, this was sort of what it took. And I will say that not all of my funders were as good at that. And I think that the results really suffered. And so it is about somebody in a role like that owning their responsibility to do the work that honestly nonprofits aren't especially well positioned to do given the power dynamic.
Thank you, Danielle. It's an exceptional point that hopefully folks take home with them today. I see we've got one last question from Andrea or Andrea about how do funders remove administrative burden of data collection while still collecting the needed data to report up to the state?
I love this detailed question. So, so the way we did it at Los Angeles County is we sort of stood up a data system, right? And so the idea is that our nonprofit providers were out in the world providing services and they would update our data system. And then we would take that and sort of collate it and say, okay, funder A needs data elements 1 through 12, and funder B needs data elements 13 through 15. Our providers were just entering data into the system. They didn't have to sort of then like pull that apart and make sure that all these data points got to this specific funder. So we it was our job to really understand the requirements of the funding and to make sure that in our data system, we were collecting those and that we were training our providers to sort of enter the data into our system. And if we're doing it really well, right, they're just sort of like doing regular case management data entry and not having to do anything above and beyond that.
And you know what, let's go for one last question. Great question that just came in on monitoring or including people who are going through the programs.
Yeah, it's a great question. So on the monitoring piece, the contract holder, so in that one graphic, in this case, it would have been the county Department of Health Services. They monitor the contracts. And I will say that I think one thing that's really critical to the success and the ability to scale there was that sort of like deep trust and collaboration. And Danielle can attest to this, but it wasn't a one and done annual monitoring. Like we were in the weeds with our providers, both sort of on the flexible intermediary side, but on the housing case management side, the housing and services team is on weekly calls with the providers. So we're very involved in sort of what I think the sort of technical phrase is active contract management, doing that sort of like weekly case conference. And then in terms of consumers being included in the planning services offered, as part of what we do with our providers, there are requirements around sort of, and I should say I used to do, there are requirements around sort of like customer satisfaction surveys and things like that. But I think honestly, I'm going to say that I think that we could all do more to make sure that folks with lived experience and the folks sort of receiving our services are included on the front end of those systems. And Danielle, I don't know if you have anything to add.
I do not have anything to add. Maybe you can't see me nodding my head.
And I know folks had to stay after a little bit to ask any questions. If you want to know more, the Changewell project information is in the chat there where you can go look at the guide. Danielle and I also, we are resources as well if folks want to follow up and learn more about Flex Pools.
Great, thank you so much, Danielle and Whitney. Yeah, and now for folks who've held on this long, we'll just finish up with our next resources, which do include the guide, and you'll receive that in our slides. So we've also had our companion worksheets to the series, so you'll receive that, and the most recent you probably should have received on Monday or Tuesday. We kind of run together, but one of those 2 days. Send it along to everyone who registered, and we will send it to everyone who's intended and registered today as well. On the next slide. Oh, and I should mention as well for folks who've responded to the survey about that and who've been using it so far, we will be reaching out in the next month or so and really appreciate your feedback with that. Also, always a reminder that ARP funding can be used for some of the areas we've talked about today to help supplement supportive services for additional rental assistance. This is just our resource for that. On the next slide, Danielle and Whitney's guide. Just wanted to share that as well. On the next slide, there are a couple opportunities from the Bureau of Justice Assistance. Currently, this includes the Pay for Success initiative, which is closing in June, but the opportunity is here and it'll be available in the slides as well. On the next slide, also the Justice and Mental Health Collaboration Program, which closes sooner, but which Sonoma, who had joined us in webinar 3, had used for their pretrial assessment and housing project as they are working through their process. And on the next slide, just another example of how communities can use federal funding to help support housing opportunities, including emergency solutions grants, and making sure that that's leveraged for people with justice involvement. And on the next slide, we are sad to say goodbye on the last slide of the last webinar in this series, but glad to have gotten to spend the past 5 webinar series with folks who've been able to join us. And also great to hear from the communities that you work in and are doing great work in. And we also look forward to hearing about all the work that you're doing going forward. Stay tuned from updates from us. And Brenda, if there's anything you want to say to cap off the series, I'll turn it over to you.
Just a big thank you. Way to knock it out of the park on the final webinar for this series. Just really thinking about how this all comes together and can be applied. So want to thank all of our presenters today and everyone again who took the time to join us throughout the series, and can't wait to see all the wonderful work you're going to do to continue these efforts and apply the information for this extremely vulnerable population that we all want to serve and put on the best life outcomes as possible. So thank you, everybody.
Thank you, and take care, everyone.